I'm Carolina.
And I'm Amanda.
And today we have two very special guests, Ivy and Macy. They're from Empower Physical Therapy, and they're pelvic floor therapists.
Yes, and we do get a lot of questions about pelvic floor exercises, and we hear from our friends and women about just different issues they're dealing with in the pelvic floor. So we wanted to sit down with these lovely ladies and ask them all the questions.
I have so many questions.
I know, we're excited. So here they come. Well, hello, ladies. Thank you so much for joining us today.
Yes, hello. Thank you for having us.
Yes, so we actually are just all for meeting today. I found you on social media on your Instagram, and I was so excited you guys answered our call to sit down with us. We get so many, just questions about the pelvic floor, and I feel like it's sort of mysterious, or more mysterious than it should be to women. And the more we can sort of know about it, I think the better. So we'd just love to hear a little bit about you guys, what drew you to physical therapy, particularly, helping women with pelvic floor issues.
Yeah, do you want to start, Macy? Sure, yeah. So my name's Macy Pastoruccia. I've been practicing in the women's health world for going on 5 years now. And, through grad school, I was really into the neuro world. I loved spinal cord injury and stroke recovery, but we had one 4-hour lecture within our whole doctoral program that talked about women's health, and everyone else was like, oh my gosh, I don't want to look at this screen of the vulva on the presentation. And I was just fascinated. And so from then on, right out of school, I just knew that this is exactly what I wanted to do. And then I became a mom. I have 2 little ones, and I got the opportunity to have both a C-section and a VBAC. So after experiencing both of those births and postpartums, it just opened my eyes even more. And so I really love working with pregnancy in the postpartum world. And yeah, as a physical therapist, I love being active, and I love the body, and just in the thick of motherhood right now. It's so fun. So I'm just excited to talk about pelvic floor and all things today.
You are in the thick of it. You have a baby and a toddler.
Yes, but Ivy is also in the thick of it. Because
well, I'll talk a little bit more about myself. So I'm Ivy Colbert. I have been a pelvic floor therapist for 8 years now. And I got into pelvic floor therapy because I also had a similar lecture where it was just this one class. I also had a clinical rotation where I saw how much pelvic floor therapy could really make an impact on people in a super intimate, like a kind of a different way. So typical physical therapists, we teach people how to move again, how to walk, how to recover from an injury. But something that intrigued me about pelvic floor therapy is that you're affecting relationships. So one of my first patients that I had in my clinical rotation, she was unable to have sex with her husband for 6 years. And after working with her, she was able to have sex for the first time in 6 years. And she came to me crying, and I was like, wow, this is something where we're really making a huge impact, where people don't know that they can get help for some of these issues, but we can help in such a dynamic way. And that affects the relationships around them too. So that's what drew me in, was that first case. And then after becoming a mom, similar to Macy, I just fell in love with the pregnancy and postpartum world after my own experiences with having a baby. So I have 2 littles right now, and I'm currently pregnant with
congrats.
my third. So that's why Macy said I'm in the thick of it right now.
That is really cool. So do you feel like the fact that you have kids, did you learn so much more about what you do after you had a baby?
Oh yeah. For me personally, I treated before having kids, and it definitely helped me have a lot more compassion for my moms. You know, they would come to me with their certain symptoms, and it was like this formulaic thing. I'm like, okay, we'll do X, Y, and Z, and you'll be better, you know. And they would come back, and it was like, well, you know, my baby was up all night, my other kid was homesick from school, and all these factors that played into why they couldn't accomplish this homework that I gave them. And I'm like, oh, well, you know, if you could just do this, then you would get better. But it's just, you know, that's not how it, that's not realistic. Right. And that's not the reality. And so after having kids and going through it, I'm like, wow, I totally have to reframe the way that I'm supporting these moms. And it's my job to help integrate these things that are going to help them heal in recovery. Not just, you know, do your homework and report back.
Totally. It's totally changed the way I practice too. I'm definitely more compassionate, give people a lot more grace because they have other things to do than just focusing on their physical therapy exercises and what they have to do. They have lives, and you just have to meet people where they're at. So that's definitely, motherhood has definitely changed the way I practice also.
And how did you guys end up linking up to working together?
Yeah. So we actually connected on Instagram too, similar how we connected. So we were both pelvic floor therapists. We're in California right now. Macy was living in Texas at the time. And we were just following each other. And I think I put out an ad to hire. And Macy contacted me through Instagram saying that she's in Texas right now, but she'll be moving to California. And so I kind of always just kind of kept a pulse on her from a distance. I saw she had like a baby, so I knew she was in the thick of it, and I didn't really want to reach out. But what happened after that?
So I moved to San Diego for my husband's job, and I saw that she put a job posting. She was hiring, and I said, what was it? Like I had just had the baby. It wasn't the perfect timing, and then Ivy just looped back around and a few months later and said, hey, like we're still looking for a physical therapist. And it was really crazy timing. It was like one of those God moments for me because we had just unexpectedly stopped our lease at our current house, and we're moving like 5 miles away from the physical therapy clinic, Ivy's clinic. And I was like, okay, this is crazy timing because we just signed a new lease on a house that's right by Empower. And I was feeling ready that I'm ready to come back to work. And so we just, felt like it was good timing, and it all worked out. So now I'm here at Empower.
Yeah. And we, it was really like divine intervention, because then shortly after that, we got started on another project that we can't share exactly too much about right now, but a huge project that we're really, really excited about. So we'll let you know in a few months how that's going.
To talk again.
Yes,
absolutely.
We'll come back on and chat even more.
Totally.
And so your tagline is pelvic floor physical therapy for women during pregnancy, postpartum, and beyond. Is the beyond having to do with like menopause and perimenopause? And do you primarily work with women who just gave birth, or what's your clientele like?
We put beyond because most people think that pelvic floor therapy is just for those that are giving birth and who have just given birth. Who are pregnant or have just given birth. And really, pelvic floor therapy is for anyone that has a pelvic floor. Kids have a pelvic floor, men have a pelvic floor. If you are in your 60s, 70s, 80s, you have a pelvic floor. So if you have a pelvic floor, you can end up having pelvic floor dysfunction. So pelvic floor dysfunction can happen for any number of things. It can happen after an abdominal surgery. It can happen after a hip surgery or just having hip pain, or after lifting something. So different things, different pelvic floor issues can develop, like even later on in life after postpartum, or even if you haven't had any babies.
Right.
See, that was my question. Like, do people who haven't had babies also have issues, which sounds like they do?
Yes, absolutely. What's a big population we see that don't have babies but that need pelvic floor therapy?
Like right now, because we've been doing more like community education on perimenopause and menopause, we have plenty of women who did not have any pregnancies or babies, and they're coming in with urinary incontinence or painful intercourse. And we're able to support them through that perimenopause and menopause with seeing, okay, what's going on? Is there tension? And they're like, no, I haven't had any issues. I've lived a very like low key normal. And then we start going down the list, and they're like, well, I had a tailbone injury. I fell while I was ice skating when I was 12, and I was a gymnast, and I had 3 abdominal surgeries. And you're like, okay, we've got a lot to unpack here.
Yeah.
But it's like you don't connect that to your pelvic floor. Like,
right. Yeah.
Many people don't, but the pelvic floor is interconnected to everything from our head to our toes. Our pelvic floor is affected like by the way we walk, because we need that hip extension and, hip rotation, that our pelvic floor expands and contracts with that rotation. It is impacted with the way we breathe. So there's so many things that affect our pelvic floor that most people don't know about. Going back to the perimenopause, so another reason why we see that population often is because during that stage is estrogen drops. So that contributes to the function of our muscles. So muscles can get weaker, and pelvic floor muscles too. There's muscles down there that help to voluntarily control our ability to hold in urine. So if muscles get weaker, then we end up with urinary leakage. So that's a big thing that we see too.
I didn't know that about the estrogen.
Yeah, well, I know we lose muscle when we hit perimenopause, and so that's one of the muscles, especially if you're not working it.
Right, but I didn't know that the estrogen was directly connected to the muscle loss.
Yeah, that's why we lose our bones too.
Yes, absolutely. Absolutely. There's so much to that too.
Yeah. And even, with muscle, but also just the vaginal lining, estrogen helps to plump that tissue up. So when we have that drop in estrogen, we also see this in breastfeeding moms. They have that drop in estrogen, but we use the word atrophy in the clinic, but it makes it a little more thin, like frail. And so that's why things like intercourse can be painful, because that tissue it's thinned out, because that estrogen isn't there to bulk it up.
Right. And so is that how pelvic floor dysfunction presents, either incontinence or pain during intercourse? Is there any other ways people would know that they're dealing with this? What are some other ways it presents?
Yeah. So I actually just had a case this morning who she had gone to her uro and her gynecologist because she swore she had a UTI. She had this burning, she had urgency. And they did all the blood work, all the urine samples, and everything came back negative. And so she came to me, and we found out there was so much tension in the pelvic floor. It was causing that urgency, that burning, pain with intercourse. And so when those muscles have tension in them, it can mimic things like a UTI, or hip pain, low back pain, tailbone pain. Constipation, all of these other symptoms that people would never connect to a pelvic floor dysfunction, we see all the time in our clinic.
So basically, if it has anything to do with bladder, bowel issues, sexual dysfunction, gut dysfunction, so abdominal issues too, from here down is everything we can treat. The pelvic floor is most likely affected if you have some of if you have those issues. I would argue if you're seeing a gynecologist, then you need to be seeing a pelvic floor therapist too.
Really?
Oh.
You mean like on a regular basis, just like a check-in? Like I go to my gynecologist once a year, maybe I can come to you guys once a year.
Yes, absolutely. It should be standard that every woman gets a pelvic floor checkup once a year because we're checking things that gynecologists aren't checking. So they're, doing things like pap smear. They're, prescribing birth control. We are looking at your pelvic floor muscles. We're looking at your full body. We're looking at the way you move, the way you breathe. We're checking your hip rotation, and pelvic floor affects all of that too. So we can definitely screen for some of those pelvic floor dysfunctions and then give you some things to do to treat it at home.
That's cool.
I think we need to make appointments.
Yeah.
Absolutely. Come in to see us if you're local.
Sure.
We'd love to have you.
We'll do a video of it.
We should.
Totally. Just not the internal part, but
we'll leave that to everyone's imagination.
What do you think is the biggest misconception about what happens to the pelvic floor after birth, after a vaginal birth?
I think it's probably when I have a mom who comes in and says, I had a perfect birth. It was the birth I always, imagined. I felt great. I was able to do X, Y, and Z. I thought I was fine. And now I'm here with prolapse. What did I do wrong?
What's a prolapse exactly?
Because it's like hanging out, right?
So a prolapse, there's different levels, different stages, but it is the descent of a pelvic organ. So usually the bladder, part of the rectum, or the uterus. And because of that structural integrity being impaired, one of those organs can drop down into the vaginal canal, and it can protrude out of the vaginal opening too for later stages.
That's so painful.
And, it's actually really common. Around 50% of women after having a vaginal birth experience some degree. But we pass off those symptoms a lot of times, like pelvic floor pressure or urinary incontinence or pelvic pain. We kind of gaslight ourselves as like, well, I had a baby, or I'm in my 50s, or, and so we just excuse it.
You mean?
Yeah.
Passing it off as normal.
Yeah, we normalize it. Because it's common, and just because it's common doesn't mean it's normal. But, to loop back around when I have a mom saying, I thought everything was good. I thought I didn't need pelvic floor PT. I always go back to saying, when an orthopedic surgeon does a beautiful hip replacement or a perfect ACL recovery or ACL repair, when they go to that follow-up with their patient, they don't say, hey, the surgery went great. I did an amazing job. We fixed it. You don't need PT. You're good. Just go ahead and start running. That's how we kind of pass birth experiences along. Like, you had a great experience. You're healthy, it looks like. You're back to doing all the things. You're good. You don't need PT. But even when everything goes perfect, we still need to recover and rehab the muscles that just not only went through significant trauma during birth, but 9-10 months of holding the baby. They were under strain and stress for almost a year. So we have to help restore that tissue.
Wow.
Okay.
It's pretty... Yeah. It's just good for women to hear that. And also that it's not normal, and you don't have to accept that. And there's stuff you can do at home to address it and feel better.
Exactly.
Yeah. And even if it does feel normal, everything feels good, it's always great to just get a baseline assessment of, hey, nothing, you're not symptomatic at this point, but I do see that you're having some tension or there is some weakness here. Our body is really good at compensating. So our body can cover up these things until, something happens and we can't compensate anymore. And then it unleashes this issue that has maybe been there for a long time. We just didn't address it early on.
Yeah.
And then you did mention some having a a patient with a tight pelvic floor. And I feel like, unless you really know what you're doing, and I've heard conflicting sort of information like, well, don't squeeze too hard because you're going to make it, the pelvic floor too tight. Or you want to, when you're doing the exercises, you want to relax all the way and then engage all the way. And like, can you do it wrong? These pelvic floor exercises and also like what is sort of like a healthy pelvic floor compared to not an unhealthy pelvic floor, but a pelvic floor that needs to be addressed. Like it could be too loose, it could be too tight, like all those things in between.
Yeah, so a healthy pelvic floor is a pelvic floor that can relax at rest, but be strong when you need it. So if you're jumping on the trampoline, you need those pelvic floor muscles to engage so that you don't leak. A unhealthy pelvic floor doesn't do that. It doesn't respond to the load or impact the way it should. And that can happen for one of two reasons. Either it's too tight, where it cannot fully relax and contract, or it's just simply too loose and too weak. So in order to determine what people need for their exercises, they need to come in to see a pelvic floor therapist so we can assess what's going on. But generally, a rule of thumb is if you have a pelvic floor that's too tight, you'll usually present with symptoms like pain with intercourse, constipation, lower abdominal pain, pelvic pain during like your menstrual cycle. Those are typically the symptoms that we see with a really tight pelvic floor.
Another one is like urgency, bladder urgency too.
So if somebody needs to go right now and they feel that urge all the time, or they're going really frequently, typically that is related to a tight pelvic floor too. Not all the time, which is why we need to do like a full assessment, but most of the time. So, and then a pelvic floor that's super, super weak or loose, typically we'll see like more incontinence, pelvic heaviness, and like feeling like a tampon is in their vagina. So pelvic organ prolapse, or what else? Rectal or fecal leakage too. That's another one.
Okay.
Yeah.
That's horrible. And so how do you go about doing an assessment? What does that involve?
Yeah, so we always look at the whole body. We start by looking at their posture, how they're walking. We check their core strength, their hip strength, the way their joint mobility is. Do they move too much? Do they not move enough? And then once we look at everything externally, we also do an internal pelvic floor exam. So what that would look like, if you were in our office, you would come in after we assessed everything externally. We would explain to you, with a pelvic floor model. Sorry, we don't have ours right here, but
actually, should I go get it?
Yeah. Go grab
We
it.
would love to see it.
Can we?
Trampolines or the hammock. The hammock.
Perfect.
And we got this too.
Okay. Do we have
The vagina?
Yeah.
We're missing it.
Okay.
Don't forget the vagina.
That's okay. Okay. Perfect. We gotta have all the layers here.
I'm learning so much.
Yeah. So I would explain, this is our pelvic floor. We have 3 different layers, and the way we examine is one gloved finger, and we go layer by layer. So we would assess, like to the first layer is pretty superficial. So it's like to the first knuckle, and then the second layer to the second knuckle, and then third layer is usually with full insertion of the gloved finger. And then we palpate both sides. So we're feeling for an active contraction. Can they relax? What happens if they bear down or they cough or sneeze? What's happening to the pressure in the pelvic floor? And then we're feeling for tension and reproducing of their symptoms. So if I have someone who comes in with pelvic pain, like during intercourse or doing a squat, a lot of times I'll be pushing around the pelvic floor or assessing, and they'll go, oh my gosh, that's my hip pain, but you're in my pelvic floor. How does that happen? And they'll swear like, oh no, you're pushing on my butt. And I'm like, no, I promise I'm not. But because of the relationship of these muscles, they refer pain to different places in the pelvis, to the low back, to the front of the hip. And so we're able to identify, is this a pelvic floor issue that's causing, your hip pain or things like that. And so after we assess all of those components, other things are like scar tissue we look at, if they had a perineal tear or any surgeries that might be contributing to scar tissue. That's another big contributing factor with pain and pelvic floor function. So then we create a plan based on what we find. And we decide, do we need to work on tension first, or do we need to jump to strength training? Is it pressure management? How is it contracting with the core? And we start with assessing lying down, but a lot of times we'll do an assessment in standing too, because the pelvic floor might be able to perform decent while laying down, but when we are in a gravity dependent position and we have the weight pressing down on the pelvic floor, if that's where they're symptomatic, that's where we want to test them. And so we can see, are they able to contract and relax when they're in a standing position too? So that's kind of what it looks like.
Yeah. And just to give you guys like a full, like an idea of what we're doing in the pelvic floor. So if this is the pelvic floor, you're looking at it from the head down. This is the spine. This is the pubic bone. When we insert our finger digitally inside the pelvic floor, these are the muscles that we're feeling. So all these layers of muscles, you can even see the tailbone there. We can assess what all of these muscles are doing. So we do one side and then we do the other side. And much like you get when Macy says like trigger points or like tension in the pelvic floor, that feels like tension like in any other part of the body. So if you are stressed and you start to tighten your shoulders up towards your ears and you want tightness like, right in your upper trap, and you have like knots in your upper trap, same thing in the pelvic floor. The pelvic floor actually has a tendency to be a holding muscle. It's very connected to emotion and stress. So if our neck is tight, we're most likely going to have some tightness in our pelvic floor too. And we can feel that. So it will feel like, any other tight muscle, like a knot in your muscle.
So you can feel knots in the pelvic floor?
We can feel the hardness of the muscle, the suppleness of the muscle. A lot of people don't think that, there's even muscles down there, but yeah, they are. And we can feel exactly what they're doing.
I had a friend who was she learned internal myofascial release, meaning through the vagina and so obviously is that for the pelvic floor, and do you guys do any manual massage to basically iron out those knots like you might want someone to do in your shoulder?
Absolutely. Yeah. That's part of our treatment. Yep. So if we assess the pelvic floor and we feel like it is hypertonic or really tense, or there's some tone there, we might do some down training or some manual release of the pelvic floor. We might also have them breathe, do some diaphragmatic breathing and breathe into their pelvic floor as we're releasing. We might move their leg, as we are holding our finger onto the pelvic floor internally to do sort of like an active release technique to move the joint around the muscle. So there's so many manual techniques that we have that can really help release tension in the pelvic floor.
That was going to be our next question, was about how important the breath is when you're doing physical therapy, because obviously for us as yoga teachers, the breath is everything, right? And to be able to release tension, the breath is so important. So I'm assuming maybe it's similar for you guys.
Yeah.
It's so important. You want to answer?
Yeah, absolutely. So it is probably the foundation with most of our patients. That is one thing that you can count on us teaching every single patient is the breath. Because if we think of the core as this pressure system, so the top is the diaphragm, the bottom is the pelvic floor, and then our abdominal muscles and our back muscles are connecting all around. So when we take that big inhale and the air fills up our lungs, that diaphragm should press down, right? And as that presses down, I'll move my hands up, the pelvic floor should also lengthen down. And then as we exhale, if we contract, if we're doing an active contraction, if we contract the pelvic floor and core with that exhale, that diaphragm moves up and it kind of acts like a vacuum. And so it helps to contract the pelvic floor or just go back to its resting position. So when we learn to diaphragmatic breathe, we inhale, it moves it down, we exhale, it comes back up just passively. So that breath is so great at helping us find that mobility and that range of motion of the pelvic floor. And we'll be able to feel that internally. If we're assessing the pelvic floor and we have them breathe, if they're tense or they have a trigger point, we won't feel that pelvic floor move. But if they're really good at moving that breath down and lengthening the pelvic floor muscles, we can feel those muscles relax all the way. We can even see the perineum come down towards us and then gently lift back up.
And do you find that most people don't know how to breathe?
I would say most of the time they're like, no, that's backwards. I feel like I breathe the other way.
I was going to say, whenever I have one of you yogis come in, I typically don't really have an issue with teaching you how to breathe because you do it so much. You do that diaphragmatic breath so much that I think it's just natural for you to breathe into your pelvic floor. So, but for a typical person that doesn't do the breath work, that's kind of go, go, go. It's just normal in our society to be kind of upregulated, living in the sympathetic system and always be on the go. We have a tendency to breathe from our chest. So we do this and use all our intercostal and neck muscles here instead of breathing with our diaphragm. And when you don't diaphragmatically breathe, because like what Macy said, if the diaphragm doesn't move up and down, then our pelvic floor doesn't move up and down either. And they're fascially connected. So when the diaphragm moves down, the pelvic floor moves down. When the diaphragm moves up, the pelvic floor moves up. If the diaphragm's not moving, I'm doing this, and I'm not diaphragmatically breathing, then that pelvic floor is not getting the relaxation that it should throughout the day. So naturally, throughout the day, when we breathe, you can kind of think of it as a buoy in the water. Our pelvic floor and our diaphragm are doing this, kind of bobbing up and down. Wow. And we should be doing that without thinking about it. But for most people, when they come in here, we have to teach them how to do that.
Yeah. I didn't know about that connection between the diaphragm because we do, know about the diaphragm and how it, expands and contracts just from being yoga teachers. But that's fascinating. So like just deep, calm belly breathing is in a way like a pelvic floor relaxation technique.
Yes.
And softening technique.
Absolutely.
And I feel like so many women, myself included, I'm always pulling my stomach in. I mean, I have time almost every day where I'm doing deep breathing and I do try to think about it as often as I can. But like women are really holding in their stomach, I feel like, because they don't want it to stick out and they're breathing up here. Just, all these types of things we're doing to ourselves, unconsciously is like we're definitely probably causing some of the tension that we're experiencing.
Totally. Like our gymnasts, our athletes, our Pilates instructors, we see this. A lot of drawing in the core, a lot of tight abdominals, like breathing in through here. So yeah, that is absolutely something that we see that impacts the pelvic floor.
Just never letting it all hang out. Gotta let it all hang out.
Yeah, I use that term sometimes when I let it all hang out. Let it all hang out. It's okay.
There's a name for that, actually, the holding in of your core. It's called hourglass syndrome. So if you look it up on Google, it's a real syndrome, hourglass syndrome. It's where you cinch in, you're holding in that TA, that deep core, all day long so that then you end up with pelvic floor symptoms because there's so much pressure here. All of the pressure is going down to your pelvic floor, and that can end up in pelvic floor issues.
Okay.
So with a weak pelvic floor, and everyone talks about Kegel or Kegel exercises, like with the strengthening exercises, is that typically what you're having women do? Is just the squeezing and releasing in different ways?
Not all the time. So again, it depends on what the person needs. So if I have someone come in and they are really having a hard time even like doing a contraction, like I say, do a Kegel or do a pelvic floor contraction, and they cannot get it, I might have some time just isolating that and having them learn how to do an actual Kegel. And we might do that in different positions. So I might even have them do it with a pillow underneath their hips to really help have gravity help them do that contraction. I might have them sit on a towel, so a rolled up towel, like underneath their pelvic floor, right between the sit bones here, because then that kind of gives a cue that, okay, there's something there. I say, okay, pull away from it. Pull your pelvic floor away from that towel roll. So there's different things, different cues that we can have to help someone engage. And everyone thinks about the pelvic floor differently. So for some people, I'm like, okay, imagine that there's a blueberry at the entrance of your vagina. Now pick it up with your vagina. Or think about sucking a smoothie through a straw with your vagina.
It's my least favorite one, but it works for some. It does work. But after I saw that video on that crazy TikTok,
yeah, you don't do it anymore.
This I don't know if it was AI or actual footage of something, but there was this video. This room, this like group class of women, and they have like a big liter bottle, like 2-liter bottle on the ground with this super long straw that's like going into their pants. They have pants on, so you can't see. And you just see the fluid like going up and down in the straw. They like just show that they're doing Kegels, but I'm like, that cannot be a real like group class.
So many friends sent me that video and they were like, is this what you do in pelvic floor therapy? I'm like, no, that's not what we do.
Leave your Pepsi bottle at home. We will not be using that.
It's just a visualization. That's it. So sometimes we do have them do Kegels on the table and in different positions, but also there's so many other things that we do to help engage pelvic floor. So that might look like squats. That might look like all fours, exercises in all fours. That might be standing on one leg. So single leg exercises actually help to engage the pelvic floor more than a Kegel would, because you're having to use your pelvic floor to hold weight on one side, and our glutes are loading and everything, and our glutes are the helper of our pelvic floor muscle. So we'll do a ton of glute exercises too. If you have weak glutes, then you most likely have a weak pelvic floor. Or a tight pelvic floor because it's not on. So really it does come down to the internal assessment. We need to do an internal assessment in order to determine what exercises to give you. And then from there, we can do all sorts of stuff. And it's not just Kegels. It's everything else.
That's interesting.
Yeah.
So it's like not real exercise, but more like you want the full body engaged rather than just like focusing on. Because we have a workout we created. It's called Flow Lift. And it's a lot of squats and it's a ton of stuff on all fours.
And standing balancing.
And I feel like, we've been doing it since 2016. I feel like it's made my pelvic floor, I would say, stronger because I had 2 giant babies and it definitely impacted my pelvic floor strength. But yeah, so I never realized that it's not just about those like squeezing exercise, but like full body and in different positions.
Mm-hmm.
Yeah, and it's all about like, oh, sorry.
No, go ahead.
It's, truly all about like what is your pelvic floor doing in those functional movements. So we could make any exercise a pelvic floor exercise if we're being intentional about what is our pelvic floor doing, and I don't want to quote the stat exactly, but it's something like the pelvic floor has around like 50% more activation when we're doing a bridge and a squat rather than just a Kegel. So they put this study, put an EMG on the pelvic floor muscles and had the person do a pelvic floor contraction, and then they had them do a bridge and a Kegel. And there was significantly more activation, muscle fibers firing when pairing it with a functional movement like a squat or a lunge. So we know that we have to incorporate functional movements to truly strengthen the pelvic floor past just your Kegel.
Right. Like making everything work together.
Exactly.
Absolutely. So something else we look at is posture and alignment. So hip range of motion, your hip balance, and then also your posture. So if someone is significantly anterior tilted or posteriorly tilted in their pelvis, that affects the way their pelvic floor contracts too. So ideally we want to be stacked like ribs over pelvis, and that really creates an advantage for our diaphragm, core, and pelvic floor to all work together. So if someone is stuck in that position, that anterior pelvic tilt posture, we can do some manual techniques to help relieve that tightness here that's pulling them into this posture. And then we might follow it up with some core exercises to help them get in a ideally stacked position, because that's only going to help the pelvic floor. And then from there, we'll do pelvic floor exercises, like squats and the bridges and single leg exercises and all those things. So we're looking at the alignment too of the body and doing manual techniques to kind of help the body and put it at an advantage so that your pelvic floor can work the right way.
And I'm sure it's different for everyone depending on what's going on with their pelvic floor, but typically, how often are people supposed to be doing these pelvic floor exercises? Is it every day? For how long? And, how long does it take to see a difference?
So, of course, it always depends, but with any muscle group of the body, research tells us that we need to exercise a muscle group at least twice a week in order to, build that strength or correct something. But, a lot of times our moms are exercising 3 to 4 times a week. And so we're incorporating these exercises and having them being mindful in every routine that they're doing. Again, that doesn't look like, okay, squeeze on every rep, right? It's paying attention to the posture. Are you releasing the core when you need to relax? And then, we're able to assess how their progress is, and we can tell if they're not doing enough or they're doing, overcompensating, doing too much. And it also depends on what is the issue. Is it true strength? Is it tension related? Is there nerve involvement? Because all of those things change the timeline, because all, tissue adapts and changes at different rates. And so if it's, scar tissue related, we might need some more time working manually in our clinic rather than, okay, let's just strengthen 2 to 3 times a week, check back. We say around 6 to 8 weeks for a muscle to have true strength changes. But if it's nerve related and we get better nerve neural activation, we might have a big difference in their function in a week because it was more of that nerve involvement. So with changes, it just truly all depends, what is causing the issue.
Yeah.
And that's why assessing and reassessing is so important, because we have to make sure that we're looking at the right things and not missing something, because there is so much to look at.
So when you say nerve involvement, with my first baby, I pushed for 3.5 hours, and after he came out, I was like, how are things going down there with my mind? And I tried to squeeze it all back together again, and I could not. I mean, it came back, but I just there was no feeling. You know what I mean? For a little bit. I don't remember how long. Really just probably a few days. I started really working at it. But is that what you mean with the nerve thing? People can't even feel the ability to squeeze?
Yeah, totally. So, our nerves, we have nerves in our pelvic floor as well that innervate those tissues. So that totally makes sense. If you've been pushing for a really long time, it's possible that the nerve could be tractioned and then affecting your ability to feel or even have that motor control postpartum. So that is something that we see too. And that can involve the nerves too.
Or compression, during pregnancy, if baby's head or depending on their position, if they're compressing a nerve, I might have a mom get leg pain or pain around the side of the hip. And so, it could be caused by baby's position or a pushing position. If you are, in the stirrups with the knees flexed up towards the chest for 2 or 3 hours, then that can compress the nerves as well, or traction different nerves. And that just creates a little roadblock for the signals that are traveling from the nerve up to the brain, back to the muscle. And so it's not this continuous messaging system with the nerve pathways. So we have to assess all of that. We have to, with different skills that we're trained in, we have to figure out, is this muscle related? Is this nerve? Is it scar tissue? What's going on? Because that determines, what their exercise program, what their rehab plan looks like. And, we live in a day and age where there's so much information out there, which is great. We contribute to the information on Instagram, of course. But there can be misleading information, or maybe it's good information, but not for a certain person at a certain time, and so that's why it is really important to make sure you're getting a personalized program or an assessment to figure out what do you need before you just, throw everything in the kitchen sink at it.
Right.
So if someone wants to book a session with you, how do they find you? What's your Instagram handle? Is there a wait time? How does it work?
Typically, we can get someone in within a couple weeks, but the way to find us is very simple. It's empowerphysicaltherapy.net. We're located in San Diego, California, in Rancho Bernardo specifically. And you can simply book an appointment through our website online. To keep in touch on Instagram, we love Instagram. If you DM us on there or send us a message, we'd love to hear from you. And you can find us at empower.physicaltherapy.
Okay. Love it. I feel like I learned so much.
Yeah. Do you guys take insurance?
We do not take insurance. And the reason for that is it can really, sometimes insurance can be a little hindrance with the way we're practicing. I don't know about what you've experienced, but when I was at an insurance-based clinic, I only had 15 minutes with each patient, or 10 minutes, 15 minutes with each patient. And then we sent them off to an aide or a tech to supervise their exercises. And often when I would look over there, I'm like, that's not what I told them to do. And so really the quality of care here, we try to have it be a little bit more elevated, where we're having a full hour one-on-one with our patients, fully supervised by an actual licensed pelvic floor therapist. And we're doing manual therapy with them. We're doing exercises with them. We're spending the whole session with them so we can truly make sure that they're getting quality care. And often we'll see patients get better faster because of the amount of time we spend with them.
Yeah. No, that makes a huge difference.
when I was in the insurance space world. I was seeing 16 patients a day, and, 2 or 3 patients during the same hour. And so I would be jumping around to different patients, and post-pregnancy and postpartum especially is such a delicate time. And especially if I'm doing an internal exam or if they have their baby with them, that's one great thing about Empower, where we understand that if they need to bring their baby or their kid, like, that's motherhood. You don't have to find a babysitter every time you come in. And, I'll be able to hold the baby or play with them on the floor for a minute while the mom is in transition or doing an exercise. We have time for that rather than, being like pressured by a tight schedule. So that has really given us the opportunity to just make sure we're giving the best care possible. But we do offer something called a super bill. So if our patients want to send a super bill to their insurance and get reimbursed on the back end, we do have a lot of patients who do that and have success with getting reimbursed.
That's very cool, but it doesn't hinder their ability to have all that one-on-one time with you guys.
Mm-hmm. Right. And then we also take HSA and FSA if people have that too.
And do you only see women?
Right now we do, yes. We both have taken male pelvic health courses, but we don't have a male pelvic health therapist yet. That's something I'm interested in getting. And once we do, we would love to see males in the clinic, but not at the moment.
No, but it is such another underserved area. I hear my husband's a urologist, and I hear it from him every day. He's like, "You really need to see men. I have so many patients that need to come see you." Everyone has a pelvic floor, so maybe in the future.
Hopefully. And if any males out there do need pelvic floor therapy, we have some great referrals we can send your way too for male pelvic health therapists.
Well, that's amazing, and I think there was a lot of revelations, but I love the idea that you should be coming to see you guys once a year, just like, and just check in and get the baseline and see where you're at. Because I'm sure it changes over time as well.
For sure.
Totally. Absolutely.
Mm-hmm.
Well, thank you guys for taking the time. We appreciate it.
This was great. Yes. We would love to hear what you guys are working on, your secret plan.
Yes. Thank you so much for having us. Yeah, we're busy in development, and we will circle back around when we're getting ready to launch.
Yeah. It's going to revolutionize women's health. So we're excited to share it with you when we launch. But so good to chat with you. And thank you so much for having us on. We're so passionate about women's health and pelvic health, and hope you and your listeners will get some good information out of this.
For sure.
Thank you.
Thank you so much, ladies.
Of course. Have a good day, you guys.
Thank you. Okay, so that was amazing. I learned so much, and I'm actually blown away, especially by the connection between the diaphragm and the pelvic floor and how they kind of work together. And so I feel like I now have to go see them.
I definitely want to go see them. And I also really loved learning that you don't have to sit around and do all those Kegel exercises.
Agreed.
And that it's more of like functional movement, AKA
flow lift. It's true. It works.
It's really, that was very awesome to hear that. So we hope you loved it. If you want to go see them and you're in San Diego, again, it's Empower Physical Therapy in Rancho Bernardo.
Thanks for listening.
Thank you.